Let's define our what? Another exercise. I'll ask you to take one and pass it down, please. So let's visualize and write down the perfect day in your practice. Okay, we all walk into the practice and stuff bothers us that nobody else sees because we're the owner, right? When there's a speck of dust on my carpet, on my dark carpet, when I walk into one of my practices, I leave it there intentionally to see how long it takes for somebody to notice that there's a piece of smudge on the ground, right? And sometimes it could go 2 days. And you just want to pull your hair out because they don't see the practice the way that we do, right? How do we get them to see the practice like an owner? Well, the sad fact is you never will. But if you have a strong enough culture within your practice and amongst your team, they will notice that smudge. All right, so here are the rules of this exercise. There are no limitations as to your facility, team, patient's procedures, or schedule. Okay, so no limitations. If everything in the world was perfect, answer these questions exactly that way. And you could do this exercise for your overall life, too. What is my perfect day? What time do you wake up? What do you have for breakfast? What do you talk about with your wife at breakfast? That would be the perfect day. That's your true purpose exercise. This is our perfect practice exercise. So these questions will help you crystallize your ideal dental practice. So let's talk about creating our perfect day. What time would you get up? What would you do before you left for the office? When you walked into the door of the office, what did it look like? Take a second to think about it. What did it look like? Was everything neat and tidy? Were the magazines kind of slightly off? Drives me crazy when my frames are a little off, you know? What did it smell like? What did it feel like? Did it feel comfortable? Or did it feel like drudgery walking in there because it was just going to be another day cutting teeth? The patients were going to be... And I had 4 people scheduled all the way across, plus 2 hygiene. I was going to be running around like an idiot. How could they have scheduled me a molar root canal and 2 crowns at the same time, plus 3 hygiene checks? All that stuff that we think about, that's not going to go on your perfect day sheet. How were you greeted by your team? How is the team interacting with one another? What time would you see your first dental patient? What type of procedures were on the schedule? How is your team dressed? Does it bug you guys when they look a little disheveled? Yeah? You're trying to present your office as a professional place, and they just don't really get it. When you overhear your staff answer the phone, what does that sound like? Does it make your skin crawl? Do you overlook it and pretend that you didn't hear it? Or do you correct it? And why is that a persistent problem that they can't answer the phone the right way? Is it the culture of the office? Is it because you're too lax of a manager? Or is it because it's the wrong person up there and they'll never answer the phone correctly? Doesn't matter how good they are at processing insurance. Maybe they're not a right fit for that position. How many patients did you see through the day? How were you greeted by your patients? You know, a lot of the marketing that we do, you could have the most awesome marketing in the world that brings in floods of new patients. If we don't identify our ideal patient and the type of patients that we want to see, we could be sending the wrong message out there. We could be attracting the wrong people. That could be the reason why you're miserable, if you are miserable. Because you're attracting more and more of the wrong people that hesitate to your treatment plans, that don't trust you, that are shoppers. And if your schedule is filled with that all day long, that's going to eventually wear on you. How did the day flow? What was your level of stress throughout the day? What was your energy level like throughout the day? How many hours did you work? Let's expand that out to the perfect week, month, and year. How many days off did you get this month, this week, this year? How much did you produce and collect throughout the day, week, month, year? How productive was your hygiene department? How many new patients entered the practice? So, this perfect day, perfect practice exercise is all about trying to reverse engineer exactly what we want our practice to look like. Okay? If there's any little thing that's bothering you in your practice, identify that on that sheet, and let's focus on those areas. Let's just not arbitrarily pick any old goal. Let's think about our true purpose and whether or not we're aligned with our true purpose with the goals that we're setting. So let's think about our ideal practice, try to re-engineer that, and logically move forward and create that. Okay?